The next topic is how to evaluate a fertility clinic from its IVF laboratory point of view. And that's a hard thing for patients to do because, number one, you're not typically invited into the lab to take a tour. It's a sterile area that's restricted access. Most IVF employees don't even go in the lab, including the doctors routinely, to minimize the traffic and the exposure of embryos to any adverse conditions. So you won't be able to visit the lab yourself or inspect it. Secondly, you probably wouldn't know the right questions to ask if you went in there, other than seeing a lot of shiny equipment that might look impressive. So it is a bit of a black box for patients to understand. The only relative measure of a lab is, of course, the result of the lab. And the result of the lab is how good of embryos do the lab make and do those embryos implant? In other words, the pregnancy rates of the clinic. And the problem there is different clinics take different sorts of patients in terms of degree of difficulty. So some clinics see a lot of patients who failed 2 or 3 or 4 IVF cycles at other centers. So they're very difficult patients to get pregnant, or they wouldn't have failed elsewhere. Other patients mainly focus on first-time patients, which would be an easier subset and therefore lead to higher pregnancy rates, even if they actually have an inferior or poorer lab. So it's hard to find a pregnancy outcome that really is kind of a standard benchmark from clinic to clinic. But probably success rates in women under 35 would be one measure of a lab success, because obviously if you're looking only at women under 35, the clinic is less likely to be sort of cherry picking only easy patients. Most patients under 35 do relatively well. And another stat you can look at is pregnancy rates with egg donation, because of course most all clinics should be recruiting young, fertile egg donors to use their eggs as a source of the embryos. So the success with donor eggs should be relatively high in all centers that have a good lab. Pregnancy rates in certainly patients under 35 should be relatively good in all centers with a good lab. And if those rates are high per embryo, that is per single embryo transferred, then you can feel that the lab is probably doing a good job. But that's a final variable. If the pregnancy rate is high, but the clinic is transferring on average 2 or 3 embryos to get that success rate, then obviously the chance per embryo may only be half as good as another clinic who gets the same pregnancy rate with, say, 1 embryo instead of 2. So knowing what group of patients you're looking at, the under 35 group or the egg donation group, and knowing if the clinic routinely transfers just 1 embryo can help you evaluate that pregnancy rate, which in turn is a proxy for the quality of the lab.